1. The nurse notes blanching coolness and edema at the peripheral intravenous (IV) site. On the basis of these findings, the nurse would implement which action first? 1. Remove the IV. 2. Apply a warm compress. 3. Check for a blood return. 4. Measure the area of infiltration. Which client would the nurse assess first? 1. The client who has a nasogastric tube attached to intermittent suction. 2. The client who needs to receive subcutaneous insulin before breakfast. 3. The client who is 2 days postoperative and is complaining of incisional pain. 4. The client who has a blood glucose level of 50 mg per deciliter, 2.8 mmol/L, and complains of blurred vision. A woman at 32 weeks gestation is brought into the emergency department after an automobile crash. The client is bleeding vaginally and fetal assessment indicates moderate fetal distress. Which action should the nurse take first in an attempt to reduce the stress on the fetus? 1. Start intravenous (IV) fluids at a keep open rate. 2. Set up for an immediate cesarean section delivery. 3. Elevate the head of the bed to a semi-Fowler's position. 4. Administer oxygen via a face mask at 7 to 10 liters per minute. A nurse is auscultating breath sounds in a hospitalized client with emphysema and hears these sounds. Which sound should the nurse document? 1. Crackles. 2. High-pitched wheezes. 3. Bronchial breath sounds. 4. Bronchovesicular breath sounds. The nurse is changing the tapes on a tracheostomy tube. The client coughs and the tube is dislodged. What is the initial nursing action? 1. Call the health care provider to reinsert the tube. 2. Ventilate the client using a manual resuscitation bag and face mask. 3. Cover the tracheostomy site with sterile dressing to prevent infection. 4. Call the respiratory therapy department to reinsert the tracheostomy tube. Which toy is the best choice for toddler age? 1. Puzzle. 2. Toy soldiers. 3. Large stacking blocks. 4. A card game with large pictures. A patient with end-stage COPD has selected guided imagery to help cope with psychological stress. Which client statement indicates the best understanding of this stress reduction measure? 1. This will help only if one play music at the same time. 2. This will work for me if 1 a.m. alone in a quiet area. 3. Need to do this when I lie down in case I fall asleep. 4. The best thing about this is that I can use it anywhere, anytime. A patient with Parkinson's disease develops akinesia while ambulating, increasing the risk for falls. Which suggestion would the nurse provide to the client to alleviate this problem? 1. Use a wheelchair to move around. 2. Stand erect and use a cane to ambulate. 3. Keep the feet close together while ambulating and use a walker. 4. Consciously think about walking over imaginary lines on the floor. Early manifestation of digoxin toxicity. 1. Anorexia. 2. Facial pain. 3. Photophobia. 4. Yellow color perception. The nurse would implement which action to prepare the client for MRI test? 1. Shave the groin for insertion of a femoral catheter. 2. Remove all metal-containing objects from the client. 3. Keep the client NPO, nothing by mouth, for 6 hours before the test. 4. Instruct the client in inhalation techniques for the administration of a radioisotope.